my God.
Wow.
Oh my God. Where did he come
Oh
from?
boy, we got push button. Oh my gosh.
He disappears, man. That's all he does.
Out of nowhere.
Oh man, how are you guys doing tonight?
I'm good. Hey, I'm good. Wonderful. Want to start the way the show goes. Want to start the show. Where to start? Amen. I'm doing well. What a great day. Welcome, our Warriors United fan base. We appreciate you. We love you. We just three good guys who love the Lord coming to talk about stuff. Our opinions, not facts. Our opinions, our truths. Don't get mad at us. If you don't agree with us, just pray for us.
Yeah.
So, how was your weekend? How was your weekend, guys? How was your weekend?
Go ahead, Simon. Let's kick it off.
Man, give me a break, man. I just got on.
That's why I'm messing with you.
Just let me breathe. No, actually, the weekend, I think yesterday's Family and Friends Day was a very, very successful day. Our church was packed out to the max for Family and Friends Day. Parking lot was full. The fellowship was great. Families came out. Yes, it was a great Family and Friends Day. I think it was great. The workers behind that did a great job. And apart from that, I just want to talk about sports because every team I got lost. So exactly. Why he got the button, man? Why does he have the button? I'm good. Go ahead.
Mark, how was your week, Mark?
The week was good. Saturday, we spent the whole day down at the Museum of the Bible in downtown DC, and we caught their production, The Chronicles of Narnia, which was really, really good. And the Bible Museum, man, they got so many interesting things in there, man. Just see all the artifacts, the old literatures and everything. If you've never gone, go to the Museum of the Bible in Washington, D.C. You will enjoy yourselves. And of course, like Simon said, Sunday was just absolutely phenomenal. Just the word of God coming from our pastor. Mm-hmm. And just to see family coming back. It was almost like homecoming, so to speak. People coming back. It was just good seeing a lot of folks.
Awesome. The Chronicles of Narnia, like Chronicles of like As on the Lion. You saw something?
Yeah, they did an actual production, which was great. It was almost like Lion King with the puppetry. Yeah, it was live production. It was almost like it was like going to Sight and Sound, but on a smaller scale.
Okay.
You know, Sight and Sound does those big productions. It was just like that on a smaller scale, though.
Wow. Okay. Mm-hmm. So great. Well, my weekend was awesome. Very nice weekend. We had some different stuff. One of my former church members, she graduated from college after 15 years or so, whatever it is, 10 years that she's been trying to get it done. She graduated and was with honors with the President's Award.
Are you going through puberty again or something?
Man, I tell you, she graduated. Hey, man, don't make fun of guys like me who are losing their voice.
Don't make fun of me, girl.
Whatever.
Oh my gosh. Oh.
So we had a good weekend, really nice weekend. Sunday was great. So looking forward to, in a few weeks, we're going to have there's a bunch of stuff going on. We have anniversaries and banquets and different stuff going on with my sister churches. So the next weeks are going to be pretty hectic. So great weekend. Let's get to this. This show's a big show, so I want to get to it.
So before that, Simon, say what you normally say.
Simon forgets, or he's frozen. 1 to 2.
No, I didn't freeze. No, I did it on purpose. No. Please continue to press the share button, the like button, and the subscribe button.
Now we did freeze.
We can't do this without you. We really cannot. So please, we love you. Continue to like us and the rest. Just please do that. Push.
All right. Hey, tonight, man, I'm excited about tonight's show. This is episode 96. We're getting closer to episode 100.
My God.
Wow. It's hard to believe, guys. Hard to believe. We're getting there. We're getting there. So tonight we are going to be talking about mental health issues, the effect it has on society and family. And I am grateful we have one of our own from the Transformation Church who's going to be with us just to help us talk a little bit about this thing that seems to be so prevalent of today. Let's welcome our guest today, Sister Denise Diggs. All right, from the Transformation Church Nurses Department. All right. Denise, welcome.
Wait a minute. Why she look like a judge?
Why can't she?
What do you got to see? She just need to collar. What?
That was not on purpose.
You're welcome, Denise. You're welcome.
So tell our listening audience a little bit about yourself and what you do and who you are and all that fun stuff.
So, besides being the coordinator for the health ministry at Transformation, I am semi-retired. I have over 40 years in the transplant area, outpatient caring for kidney, liver, and also recently helping out in the heart and lung transplant area. So mental health isn't my primary field of expertise, but when we are taking care of patients, we do have to consider their mental health as long as along with their physical health. So while this isn't my area of expertise, I hopefully will be able to answer your questions to your satisfaction. And thank you for inviting me.
Welcome.
You're welcome.
So I'll keep up. So Denise, why do you think mental health can be so exhausting on someone who's taking care of someone and that is going through something like that?
Because there's so many ups and downs. When a person is before even the person is diagnosed, you may notice a change in maybe their appearance, the way they keep themselves, the change in their behavior, just subtle changes initially. And then it's important, if you're concerned, then if the person doesn't bring it up to you, you need to bring it up to them to say, I notice that you're not taking care of yourself as you normally would. Is there something going on? And if they acknowledge themselves that they realize something is different, then you should encourage them to seek professional help, start with their primary care doctor just to figure out exactly what, if anything, is going on. Sometimes it could be just like a chemical imbalance within their body, but it could also be changes within the brain itself. It could be underlying stress or post-traumatic stress from a previous event. It could be something as serious as a brain tumor. So it's important to have the person be diagnosed. Then you need to make sure that whatever the prescribed plan of treatment is or evaluation is to be sure that they will follow through. And if it's getting other evaluations, they should do that. If it's taking medications, you can be helpful in making sure they're taking their medication. If they develop side effects from the medications, then you need to encourage them to talk to their doctor or their healthcare provider, mental health care provider, and make sure that changes are made as needed. And then it's just, some people aren't ready to talk about it, but just being there for them is most important. And then there's some people who may be aware that there's something going on, but they're reluctant to to get a diagnosis or to see a healthcare provider for treatment. And then once they're seen, they may not want to follow through with the prescribed treatment. So that can, affect how well they respond to treatment and the outcomes. So
Well,
that's why it's so difficult.
Well,
and then
I'm glad you made this statement.
Go on.
You said that people are reluctant to talk about it. And I think that is one of the key things, because people are going through things and they're afraid to talk about it because it's either they're embarrassed about it or they don't know how
Right.
to deal with it, or it can be a whole, gamut of stuff to why people don't want to bring it to the forefront.
Right. And that was going to be my next comment, that they're afraid of being ostracized or, by family or friends. So, they may not even want to talk about it.
But Denise, there's a difference between mental health, right, and mental illness. Correct?
Yes.
It might be a thin line, but there is a difference.
Yes. Mental health covers the whole gamut. Everybody, just like your physical health, you want to be in good physical health, you want to have good mental health. Mental illness is when there's a deviation from the norm, or some other process going on that needs to be addressed.
So like depression would be a mental illness.
Depression, yes.
While the stress of depression becomes your mental health. So something on that line.
Yeah, affects your mental health. Yes, and as we're speaking of it, I know depression is probably the most common mental health illness that we see, because everybody, whether it's chronic depression or just depression related to an episode, whether it's maybe the loss of a loved one or a loss of a job, that can be a temporary problem, whereas somebody that has chronic depression may, this is a long-term problem. It requires intervention by a mental health provider or medication.
Okay.
Yeah. So, question. So, how difficult is it for you? May see someone who may have a mental health problem. So, how do you really approach them? Because they could be in denial, or refuse help, or saying you the one who got the problem. How do you go with that situation? What do you go and get help yourself to see how you can help them? How does that go?
Well, you have to start a conversation first to see, just say, like, I notice that you seem to be acting different, or, dressing different, or, and then whether they're more anxious or have kind of pulled back to themselves and want to be isolated, and you have to start the conversation with them if they're not aware of it or don't want to admit to there being a problem. And then you encourage them if they're struggling with, like, the death of a loved one. You encourage them, sometimes they just need to talk to someone. There are support groups for people that are going through bereavement, or they need to just talk to their healthcare provider and find out whether it's something that is temporary that they'll get over with, or whether they need to seek for, have further evaluation and possible treatment.
But like what Simon was saying, like sometimes you're dealing with people who are in a state of denial. So
Yes.
Even if you try to get them to go seek help, they're not going to do it because it's almost like they're just making it seem like it's your fault when it's not your fault, but you're trying to get them to go seek help and they don't want to do it. And I think that's what I believe that's what he was trying to say. The challenge is trying to get that person to get that help that they need when they don't want to do it themselves. And then how would you get them to get to that point of getting help when they don't want to get it because in a state of denial?
So you should talk to, if you're not a family member or someone close to them, to see if they are noticing the same changes that you notice. And you can talk to a healthcare provider yourself, expressing your concern, or somebody with a mental health background, expressing your concern and saying, what steps do I need to take to get this person to recognize that, they need help, and that the way they're acting or the way they're dressing isn't normal. So it can be difficult. But if they're not able to recognize it, a caregiver or a close friend or family member should try and get more information about potential mental illness and try and find ways to help them.
Yes. So thank you, Denise, for that. But let's just so people, excuse me, just so people that are listening can understand what those signs that they're looking for. So in the case of when we deal with mental health issues, there are emotional and behavioral signs, or maybe they're persistent sadness you're talking about, or hopelessness, or they have excessive fears or worries. Or like you were saying, street mood swings, right? They're happy 1 minute, totally, sad the next minute.
Right.
There's thinking and perception changes, clothing, or personality, like you were saying, personality changes, right? Physical lifestyle signs, they dress differently. They're beginning to look different, or there may be risk related behaviors where maybe they have increased use of certain things, or they have these impulsive actions they're doing. So those are the signs that you look for in someone. And when we're dealing with mental health, the hardest part, I think, like you were saying, is getting them one to admit it, but also it's us recognizing it's not that they're crazy, it's not that they're mad, it's not that they're going out of their mind or insane.
Mm-hmm.
They really have some issues that are just so traumatizing to them, they just can't cope. And
Yes.
oftentimes we deal with these people thinking that, they're just, I can't do that. They're always angry, or they're always crying, or they're always sad. Well, it could be an issue that they just have not gotten over. Like you were saying, the death of a family. I knew a lady who her husband died, and for like 10 years, she was still going through the grieving process. And at first I couldn't understand it, but I found out, it's a mental health issue. She could not let go.
Right.
And I think that we have a lot of those folks that come into the church looking for an answer. And sometimes we don't give them the right answer. Jesus is the first answer.
Right.
But then it's also finding a group. I would think finding a group of people who can be support. I don't know what you would suggest. Maybe you can suggest it, but I would talk about finding the right people who can be support to you to help you get through the process.
Yes, that is important. It can also be finding a support group for the individual that's affected, but also for the caregiver, because again, you don't know how to navigate taking care of someone with that, or that you think has mental illness, or that has been diagnosed and has mental illness. So support groups for both is one way to start, so that you can talk to other people that are going through the similar things that you may be going through.
So like a spouse, you're talking about the caregiver, the spouse, or maybe the child is taking care of their parent,
Right.
or the parents taking care of their child, or the best friend who's always going over there to help out because there's nobody else to help. You're saying that they should also find support groups to
Right, because
their resolve.
Right. So family caregivers are like the largest group, and they're usually unpaid. So you, as a caregiver, you're going through a lot of stress yourself, because many times you have to you're taking on extra, not necessarily burden, but you're helping someone else. So that's added to your plate. You may have to give up your job or cut back your hours. You're going to have to maybe help them with their navigating their appointments, taking care of their medications. A lot of people may not even have enough insurance to navigate how how am I going to pay for this? So, I can't afford to see a psychiatrist or a psychologist because, my insurance doesn't cover it. So there's a lot of things that the caregiver can do to help them navigate. But again, being a caregiver, if this is new to you, you're going to need somebody to talk to somebody that has had experience with that. You can do a lot of research online too. And there different states have different, areas that are available to help caregivers. And you can contact your state Department of Health for assistance on navigating how to go about dealing with this. And there are different mental health organizations also available that may be able to help someone navigate this process.
So Denise, I have one for you, and this is so key. I've heard a lot of people say this, that they're dealing with someone and that person has become very violent. They're cursing, they're throwing stuff, they're doing things of that nature. How does a person who is related, or the caregiver or family member, how do they deal with that? Because you love that person, but now they become so violent, sometimes they don't even recognize who you are. They just gone off the deep end. How do you deal with that if you're trying to take care of that person?
And that is seen a lot of times in patients with dementia, or those that are, well, there are different types of dementia, but even including Alzheimer's. So you first and foremost, you want to make sure that they're not going to harm. You don't want them to harm themselves, and you don't want them to be a harm anyone else. So if they get to that point where they're really violent, then you may need to talk to their healthcare provider. The healthcare provider, and get them either admitted for evaluation so that they're safe themselves, and then it could be adjustment medications or maybe therapy of some sort to help them address their anger.
Okay, let's talk about the church. When I say the church, is that early back in the days, if someone was going off or someone had an attitude problem, we would just take them up, take them out the church, bam. Now, because mental health is so high, how you talk to people now, how you handle people is a team effort now in a church situation, because that looks like now security has to work with the nurses, we have to work with the ushers. So we just don't want to just, sir, you're being too loud. You need to go outside. Because now our minds, we don't want to even try and trigger them further than what they are. Because right now we think, oh my God. In your mind, I'm not saying that, we're saying that loudly. We're just saying, oh, dang, okay, how we handle this situation. So now we have to even talk more than before we react, because now we're living in society where don't touch me. Don't you put your hands on me, because I'm going to sue you. Don't do this. Don't. So the branches, it's more difficult for someone who has to deal with the issue than the person who's having the issue, because we have to watch our P's and Q's and what we say and what we do. And people got cameras out now. Look, someone in the church got their phone out, videotaping the whole situation. So that's, to me, that's getting an uprising even more. How is that worse for you now, Denise? Because you're a nurse. You can't just give them a needle and say, quiet down.
Well, it's most important to get them try and get them away from the situation that they're in. So you would escort them out, try and not touch them, just say, can you come with me quietly? So that, because if you get upset, then, that's going to maybe affect them, and they'll get more increasingly upset. And we can bring them out, take them right into the health suite, and sit down and have. It's recommended that there's one person generally that will talk to them and try and figure out what's going on. But certainly, you want to consider the safety of both individuals. So you want to have somebody standing by just in case they get violent against the person that's speaking to them. But initially, you want to remove them from the situation to a quiet area and try and just talk to them and calm them down and help try and figure out what's going on. As a nurse, you can do an assessment to see, if they're oriented to person, place, and time. And hopefully you can, get, if they're not answering, they don't seem to be responding, then more than likely you need to call 911, because that's a situation that you wouldn't necessarily be able to handle in the church.
And this is the crazy thing, and because you bring this up about you can't touch the person. It's funny because I've been in church all my life, and I remember the days when somebody went crazy. Some of the brothers might have to get up and just say, "You got to go," and they would just take them by the arm and take them out.
Yeah.
If police came, they weren't coming for the church. They were coming for that guy causing the trouble. But nowadays, it's almost as if, like Simon was saying, social media, all these things, the laws have made it so that the people who are causing the disturbance, even though they might have a mental illness, they that are causing disturbance have more rights than the people that are being disturbed.
Yeah.
And the more we want to do, the more trouble we can get in. And especially like in a church, because man, if that gets on the social media, they run the story any way they want to. They say anything they want to say. There's no real journalism. It's just, this is what we think that happened, and we're going to tell you what we think happened, and people believe it. They carry it. The guy could have been probably hitting the person in the back of the head, and we had to stop him from doing it. But they'll say, "Oh, in the church, the deacons grabbed this brother who was just praising the Lord." It's crazy. So in this case, why do we think that mental illness is being so pushed forward today, where 25 years ago it wasn't considered mental illness? It was considered bad behavior, or was considered, the person's just losing their mind. What's going on? What caused this change in heart in society? If anybody knows, this is a question for everybody.
Well, I think I read that there's actually been an increase in mental illness since COVID. So with people being isolated for so long, I guess a lot of people were really affected by that. So that's one reason. I think the social media is another reason, and I don't know why the U.S. has such a problem with guns, because that's one thing you have to be really concerned about that these days. And then you got the guy driving his truck into the church. I don't know.
That's a whole other story where they're so concerned about mental illness, but they're not concerned about those people carrying guns.
Right.
There's no gun laws restrictions, but yet we got to kill people with mental illness. So yeah, but guys, I'm sorry. What do you guys think? What do you think is the prevalent issue? I do not believe COVID did this. I know I agree with this, what they're saying.
Right.
I don't think it's COVID. I think people are just using the struggle of their life. For me, I don't think it's everybody, but I think there's many people out there that's just using struggles of their life and saying, I can't cope. Instead of back in the day where you said I had to cope. I had no choice. It's almost like a scapegoat thing.
But also look at it as also, really look, it is a spiritual warfare thing too.
Oh yeah.
Because realize that mental thing is a spiritual thing. So you got to look at it from that aspect as well.
And Simon, what do you think?
I think that more people should press our like button and our share button and our subscribe buttons just to continue this show. That just walked right into that. That one was really easy. And
softball.
it doesn't matter how you feel. I mean, you could be sleepy and just fall down and just push the button. Just push the like button, subscribe, and share button. We love you all and we appreciate you. Just like having Denise on the show. This is a great topic. And this topic could go on for weeks on the show because it's so broad. But as we go on with that, I tend to think my dad used to annoy a lot of people because he was a choir member. He used to say, "It's all in your mind." he would always say, "It's all in your mind." Yeah. If you want to feel that way, that's how you want to feel. It's all in your mind. He would say stuff like that, and in essence, he may be right. Sometimes he may be right, but you can't say that now because I just think I think there's a lot of it that people just use as a way of getting out. When someone does a murder, a killing, or something, they evaluate them and they want to say that they are crazy.
Right.
Because they might get a lower sentence, or they might be put not in jail but into a mental. I think a lot of it, and that's not everybody, but that's a part of something that it's just easy now just to say, I have mental illness.
Yeah.
I'm depressed. I have anxiety. You got the children saying it. So it's an easy process to take, not saying that they don't have it, but so now we just have to, it's medical, it's doctors involved, nurses, caregivers. How many times have we said in the last 25 years, you talk about your caregiver? We usually say, I got to go to my doctor. I got to go see my nurse. Now it's caregivers because they have to see you continually to make sure that you don't get worse than what you are. That's just my opinion right there.
So we're about to get to some of these questions, and studio audience, please forgive us. There seems like a little delay on our end. We don't know why that's happening, but hopefully it's coming loud and clear. On my end, you guys are freezing, so I don't know what's going on. Maybe it's my end, but you guys are freezing. But praise God, we're gonna go through this anyway. Let's get with those questions that came in. We thank you for already putting them out there.
Yes,
You're having a mental breakdown right now, Mark.
Me?
You're freezing right now. Let's talk, brother.
You guys are freezing. Okay, anyway.
Let me ask Denise a question because she's going to laugh. Before we do, shabba-ba-ba, someone speaking in tongues. Anyway. Without laughing, Denise, without laughing, do you think I got a mental illness?
Yes.
Yes.
No.
Thank you, Denise. She's still laughing.
Denise, come on.
Okay, jokes aside, here we go. Shabba-ba-ba with the speaking tongues.
Another thing that I didn't mention before, also the prevalence of drugs and alcohol in our society.
Yes.
Is also leading to increased prevalence.
Yeah, but then some people talk about, right, then they'll say, I'm trying to cope. So first they take, I'm just smoking this just to cope, and then they get stuck on drugs or take harder drugs or drink more. I think it's all part of the journey to people just being out of their mind in whatever capacity it is, whether it's mental illness or mental health. They're out of their natural mind because of they try to find ways to cope. Back in the day, if you can't afford to go to the doctor to get your prescription, you go drink. You get alcohol and become an alcoholic. Now things go crazy. I guess what society has become is a bunch of people who just say, I don't want to cope, so I'm going to do this.
It's a medication thing, though. Medication. Some people take 3, 4, 5 medications at one time. So, and then when you hear what a medication can do precisely, it has more diseffects than what you taking it for.
I can't even begin. We can't even begin to talk about this because I'll just go crazy.
Oh, okay then.
Don't start on sports. Oh,
And-
because
and
Ray
actually-
lost.
Yes, it's a bad week. Yeah. Anyway,
that's a nice
next
topic.
question.
Let's keep it moving. Keep it moving.
Yeah, let's keep it moving.
Commanders lost too because the Commanders.
I know you're hurting.
Mental health, anyway.
Push the button, man. Someone's
Good to see you
complimented.
tonight, Esther. Good to see you. So Esther's saying that they're okay. Dr.
Oh,
Gibson's church is
okay.
going to the Museum of the Bible. All right.
Yeah, that's a plug-in for Dr. Gibson.
All right. And then Esther says,
Oh, shout out to Denise. There you go, Denise. Look at that.
Hey, Esther.
Oh, another shout out. Hey, Auntie, how do you help someone who's depressed, but they say they are fine and they don't want any assistance? I think we kind of talked about that a little bit.
Yeah, we did. Basically, you need to have someone talk to them, and if they're unwilling to admit that there's something going on, then they need to. You maybe find a support group for yourself so that you can learn how to help them navigate their depression, and maybe get them to attend a support group. And you may need to go with them just so that you will have the information that they were given as far as what they need to do. I mean, that's if you have, it's hard, you're limited unless somebody recognizes and knows that they need help.
You mean I can't scream at them and tell them you need help? You need help. What the hell are you? I can't do that.
You can do that. I don't know if it'll help them.
No. What's just said that? What if someone's on medication for depression and they say after a few weeks, I'm fine. I don't need it anymore, but they do. How do you overcome that type of thinking? And I know a few people who have taken their medication and all of a sudden that people say, oh, you're looking well, you're looking fine, you're looking good. And they're feeling fine. Then they feel like, you know what? I don't even have to take it no more. Then all of a sudden,
I do it all the time.
yeah. Okay. You're different.
So that actually is a problem, not just with mental health medicines, with
medicines.
all medicines, especially if they're having a side effect. And then they say, well, you know, it makes me feel worse. Then they need to talk to their healthcare provider and say, you know, well, I'm feeling better, and you think I need to stay on this medicine? And hopefully the healthcare provider can get them to realize that the reason you're feeling better is because you're taking the medication. Mm-hmm. And if they're having side effects, sometimes you need to either change to a different medication or adjust the dose so that they don't have the side effects. Because sometimes you can get the benefits of a drug without the side effects at a lower dose.
Okay. So I should keep taking my medicines, is what everybody's saying?
Yes.
Yeah.
Please continue, sir.
Yeah.
What's the next one? Okay.
She says, Esther Back says, are most mental illness admission or voluntary?
Oh, I don't know. I think maybe early in their stage of the disease, it may be voluntary. If when they realize that something's wrong and they want to get help. But sometimes if somebody is really off the wall and not taking their medications and are really uncontrollable, then you would have to seek emergency admission to get them in. And so speaking of which, another part of being a caregiver is sometimes you may have to take over that for them, their financial
I was
and
going to bring that up. Yeah.
their medical care. So you need to have power of attorney. And then also for mental illness, there's another. It's called it's a power of. Let's see. I was reading it earlier. It's called a psychiatric advance directive, where you can take over for them, and you can get them admitted.
Mark went out. Breaking up. She froze. Oh, what's going on? She froze?
No, she's fine.
You're
Okay.
frozen.
What's happening?
You can take.
Everybody was freezing.
For their financial, physical, and health needs. And it's helpful to get that done before, especially in the case with someone with dementia. It's helpful to have those documents in place before they deteriorate. And then there can be a clause in it where, as long as they're able to make their own decisions, they will do that. But if they're unable to, then the power of attorney would kick in. And then if they don't, if they have a crisis and they're haven't gotten these documents beforehand, then sometimes you have to apply through a court for guardianship or conservatorship. And that's something that's ordered by the court. And they would have someone that's legally able to speak for that individual.
Okay.
Wow, that's some good stuff.
And that's the U.S. I mean, we're fortunate we have other countries watching us, England and some countries in Africa. But that's the U.S., right? Other countries may not have the benefits.
That is the U.S. And even in the U.S., it can vary state to state exactly what the different laws are.
Okay, Natalia says COVID didn't do it. It just brought it in front and center. That's my opinion.
That's her story. She's sticking with it.
Sticking with it. She's not going anywhere else.
Sticking with that.
Larry's back.
After
Hey!
a month out
Welcome
of
back,
silence.
Larry. We
There we
missed
go.
you, man. Welcome back.
Yeah, Larry.
And of
Miss
course,
Denise.
stay
Oh, dear.
right in the form. Staying just like Larry.
You're
Staying
reading-
Larry. Okay, do it. Miss Denise,
Oh, my
which one of
God.
our
Miss-
hosts do you think is closest to mental illness?
I'll take the fifth on that.
Okay, I'll say this. Who do you think is the furthest away from mental illness?
Myself.
I'm gonna say Mark.
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 No, she said herself. There you go.
Good answer, Denise. Good answer.
Oh boy.
Here
Both of
comes
them
up.
on at the same time from a month.
It's just commonplace.
Something does not happen.
So I heard a young woman
I heard
say
a young woman say,
it does not happen because she did want to be depressed. We never did that back in my day. Generation Xers were just tougher.
Hmm.
Well, I'm not Generation X, I'm a baby boomer, so I don't know.
Yeah, I'm a baby boomer as well, so I wouldn't know.
But Generation Xers, I don't know if they're tougher, but again, I think where society has gone has made people be able to do certain things, right? When kids were playing sports, there was a winner and a loser 30 years ago, right? Somebody had to win, somebody had to lose. You kept records. There was trophies for the first place team, maybe medals for the second place team, and so forth. Today, everybody gets a participation award. We have created a society, at least here, that does not want to hurt anybody's feelings. And I think that's what's happened. I think we become more sensitive. I think that's what. So I don't know about if we were tougher, but we were just not as sensitive because it wasn't given to us that way. when I came home, whatever was on the table is what you ate. You did not get to say, I don't want that, make me something else. That didn't happen.
In my household, my mom was like, McDonald's is up the street. That's what she would say. Go like this.
You didn't eat. You went to bed hungry.
That's it. My mother was like, you can eat this or you can eat nothing. Your choice.
Nothing. Yep.
Well,
and you're not getting up in the middle of the night, coming down, eating no food.
Because we had the McDonald's up the streets, I guess I was privileged.
Yes. Yes, you were.
Oh, this is one of Simon's favorite ones here. A common saying of today is, it's okay not to be okay. And that many help someone to admit that they're having a problem. We had a show about that when people would say it's okay, when we know it's not okay. And that, I think we're in that generation again, where that word has surfaced so many times. It's okay, or I'm okay, but you're not okay. And that goes back to what you stated earlier. Some people just don't want to admit the fact that they're going through because of, we use examples of embarrassment or how you're being perceived. If you're not okay, say something.
Yeah. Yes. It is not okay to be not okay. There is help.
There's hope.
There is help. And if you're not okay, admit it and go find help. We are fortunate. We know the man who can help no matter where you are. You know him. You have a relationship with him. We are grateful for that God. If you don't have that and you're listening to my voice, the first place I'm going to tell you to go to is go to the altar. After that, seek professional help, because it's not okay not to be okay. You can endanger yourself. You can endanger other people, and there is help out there. So go get the help. That's my opinion on that.
Denise, what do you say about that?
I agree that, it's not going to get better on its own. So first, going to the altar, it always helps. And then outside of the church, you need to seek professional help to help you get over whatever you're going through.
And the old church didn't like professional help. So if I said that to my mother, Mom, I'm going to seek professional help, she would just tell me straightforward, Jesus is a professional.
Go get the oil.
I know he's the only professional you need.
And I know in the African American community, it's been as a stigma as far as you getting help for your mental health.
Yeah.
But I also know more people today that I've spoken to that have talk therapies, that someone that they can talk to about what their particular situation is that can help them. So I think it's becoming less of a stigma, but it's still there, especially for African Americans.
When you talk to generation, the now millennials and those the generations after them, they have no problem going to therapy. Even though they don't even need it sometimes, they'll just go because it's in their insurance. I go to seek help. And it's just, they just go. Brother Keith, this is good information. We should have some basic discretion. What's that? De-escalation training. Yes. I've had de-escalation training. I failed. I don't have enough patience.
But no, to his point, that's something I think is truly needed in a lot of churches, de-escalation training. I mean, Simon has been working with security about how to de-escalate certain situations when we encounter it. But a lot of times the people in the congregation may not know how to deal with it, because we live in a day now, somebody just flipped off in a moment with just by walking to church, all of a sudden, flipped off. How you de-escalate that is so important.
True. It's true.
And the good thing about that is, and we've done it on a couple of occasions where the security and the nurses, we can work together, and we may be at the situation, but we know that the nurse should do most of the conversating with whoever it is, and it's just our job. Whatever the nurse says is to keep people away, and whatever the nurse says, what if we need to take them out, or let's do this, let's do that. That's where the communication will help for a better situation. Of course, every situation is different.
Yeah,
but
because you have a big church.
say that again.
Yeah, because you have a big church. Some churches don't have security and nurses. Most of the churches in this country are lucky to have one or the other. So
No, you're not going to kick us to the curb like that, because there's a lot of big churches who may not have that neither, who don't even do that.
No, not nowadays. Every big church has security now because you have to.
Yes.
And they have nurses because you have to. The churches that really the smaller churches, even middle-sized churches, will have that now because you have, especially with what's going on in today's society. At least on the, I would say, on the evangelical Pentecostal type of churches, oneness churches. They met the Catholics yet. They have not done that really, but we have that. Mm-hmm. It's the smaller churches with under, that people are volunteering, that it becomes that person has the same job every week. They worked all week. They're coming to church. They really don't want to give that time of their profession during those couple of hours of church. It becomes a burden to them. So small churches don't have that benefit sometimes. It's a good thing when you have it. But if you don't have it, you have to have other answers. So ministers, deacons should train. If you're a small-time church and you have a lot of people, send 1 or 2 people to training, to counseling, because it's necessary, because it's going to be coming in the church.
Yes.
That was
absolutely.
I wasn't bashing the big church. I was just saying, you're fortunate. Collins from Kenya, my buddy, with my book and pen taking notes. I love enjoying the sessions. Baba. It's a good statement from Larry. This is kind of true.
Yes.
Big Pharma got us all on pills for everything. 20 years ago, we did things differently. Don't trust every pill your doctor pushes on you. I agree. Larry, we finally agree on something. I agree.
Yeah.
What?
Yeah. So Anita says, how do you determine if someone is actually mentally ill versus someone who has fallen into depression?
So there are different types of depression. There's situational depression that usually resolves over a matter of maybe weeks, as opposed to chronic depression, which goes on for extended period of time. So someone that has chronic depression should see a healthcare provider, and a mental health provider, and they would have to determine whether it is, depression is a mental illness, but it would be a mental health provider that would determine whether or not it is just depression or there's another factor causing the changes.
Thank you. Ken,
Okay.
now genetics were built like tanks. All generations after are built like plastic tails. I don't know if they're built. I think we created them.
Stupid.
Wait, something. Wait,
What's
something.
happening?
Gone.
What happened?
What's happening? We freezing?
No, there was some messages that went up there that I don't see anymore. I don't know where they went.
Oh, the ones from Holly?
They were Hollies, yeah. I
got rid of them.
Oh my Lord!
She asked not to show them, so I deleted them for her.
Oh, anyway. Oh, Edward says that there are agencies in Baltimore that offers free medical and behavioral health services, which Mark will probably get soon. Uninsured individuals such as Shepherd Pratt, Maryland Crisis, Stabilitation, and with Santos. Okay, I'm just laughing my head off what he just did to Holly. I'm sorry. Okay.
Yeah, because I know what she said. I read them, so I know.
And I did too. Anyway, yeah.
Okay. We pretty much had to sit at the dining room table until our plate was clean. Yes, one of us fell asleep at the table because we didn't want to eat what was there. Yeah, I've done that. Your vegetables weren't kidding. You're not getting up to finish your vegetables. I'll just sit here then. No big deal.
Go ahead, Simon. That's for you, man.
Not okay. Has a broad range. A nice vacation retreat can probably settle some of that dust. I don't know.
Amen.
It probably could.
True that, overseer. Hey, man, don't say overseer on here. People are going to think I own slaves. True that, overseer on the church-sponsored training that would encourage small church leaders to participate. Yes.
Yes, I agree.
Yes. Yes, it's important. So we have about 2 minutes.
I think the most important thing, as we're listening with what Denise was saying, I got the most important is having patience with those who are going through those mental illnesses, because it takes a lot on us as well as it takes a lot on them, because they're trying to express themselves in a way that they're not normally, able to express. I mean, I had a family member when we found out she actually had a brain tumor because she was doing some things that was not normal. And then to come to find out, that's what it was. That thing was really causing her to do things that was not the right way. So it's something when you think about when someone's character changes suddenly like that, something's not right. And that's why it's important, like you said, make sure they go seek medical attention to find out what the actual cause could be.
And sometimes it's a cry for help. We have to remember that too. Sometimes it's a cry for help. When people go through mental health issues, sometimes they don't know how to do it any other way, and they fall into some sort of lifestyle change, some sort of whatever. They're crying out for help. So don't be afraid, everyone, to address these people. We don't want to make it sound like these people, we can't help them. You can.
Yes.
Yeah.
Your encouragement, your love, your care can snap people out sometimes and bring them back. And
another factor for caregivers is caregivers may also need to seek help for their mental health because they're taking on the extra burden and the stress of helping someone else. So they have to look out for their mental health also.
Yes.
Wow.
Yes.
Wow. This show went by so fast.
I don't know what happened. We just got a whole bunch of things just came in. So we're going to go through.
Yes. Someone's radio show came on. You might want to scroll that one. Yes, please. Listen.
Dr. D, Pastor D. Yes, please listen. As a teacher of students with special needs, I'm making my points. Listen, even if I don't understand, I'll say no. I've never dealt with that, but you can explain it to me. Hey, my guys. Yeah.
Hey, my man. Good to see you.
Yeah.
Good to see you. Hope you and Lady here well. Good show, Mr. T. Rupert, and I agreed. Some folks
open the door.
Like, okay, Monica, back in the day, everything was a demon. Yes, I was going to talk about that. Just keep the listening ear. Yes, Holly, you're correct. Keep the comment. I wish we could, but we are overtime.
We are overtime. Wow, guys, thank you for joining us tonight, and stay tuned next week. You hear say,
you're welcome.
You're welcome. You need to stay on. Hallelujah.
Okay.